Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Well, hello, everybody. This is Dr. Kurt Woeller. Welcome to the podcast. And today I'm joined by an Elena Naginsky, who is a nutritional consultant. We're going to have a conversation about cancer, and she actually has a unique story with regards to cancer and some very interesting information on a specific type of intervention called Rigvir, which is something I hadn't heard of before. Now, she also does a lot of nutritional consultations for people with chronic health issues, including individuals with cancer. So we're going to talk about nutrition as part of this conversation and some other interesting topics and things that she's involved in. So Elena, welcome to the program.
Thank you very much. Thank you for having me.
So before we get started with the main point of our conversation, give the audience just a little bit of background on your training, the focus that you take, in your profession, and how you got interested in this particular topic of cancer.
More than 20 years, I have managing my own health challenges with a lot of alternative ways. And these challenges was include overweight, diabetes, removal of gallbladder, removal of thyroid glands, severe insomnia, and most notably in 2018, my husband was diagnosed with myxosarcoma. And from there, my journey was started. I went, because my husband refused to do any conventional treatment, I started to do my research. And through my research, I went through a lot of alternative clinics in Mexico, in Germany, in Israel. And during my research, I found that Latvia has alternative treatment, the Rigvir. And I was interested about that. I contacted Latvia clinic. I sent information to them. They look my husband test, and they offer us a program. But of course, it was very strange, but nobody knows about that. And I started to look around. I started to find people who used Rigvir already, who know about this Rigvir already. And I found through internet people who have a cancer and who actually using that treatment as a Rigvir treatment. I contacted them and they told me their story. One of them told me about that she started with Hope 4 and after that went to Rigvir. She has eye melanoma. And she already using Rigvir about 5 years. And we decided to try. In November 2018, we went to Latvia, checked my husband with a lot of tests, and started to do Rigvir. And the program, aggressive program of Rigvir for first 3 months include first 3 injection every day, and after that, 1 injection each week. This is for first 3 months. And what we did before those 3 injections, we did a blood test to check his immune, blood test, and see if Rigvir during 3 days does something different. And actually, it was very strange, but during 3 days, his blood test already showed that he is kind of taking Rigvir. Rigvir will help him. And we decided to go. And from November 18, he is on Rigvir till now.
So let me go back to the beginning, and I want to kind of make sure I get everything here. So I know your husband was diagnosed with something called myxosarcoma, which is a connective tissue cancer.
Yeah.
So, and it can be found in multiple places throughout the body. I know it typically can manifest, in the extremities. And I believe your husband, that's kind of a place that was first recognized, right? There was a bump of some sort that showed up and it didn't go away. And so you saw, a surgical procedure, they biopsied it and came back with this particular diagnosis. Do you remember what was originally recommended for him to do from
Of course, I remember. Because we didn't know what this is a cancer before the surgery, before biopsy came back. We thought about the lymph lump. It was a shock for us, of course. And right after the surgery, right after the first surgery, right after the biopsy result, we went to see oncologist, and our oncologist told us that, guys, you are very lucky. You are in Chicago. We have 2 universities here. We have a lot of studies here. He sent us immediately to do MRI result, to see PET scan result, to see if he has metastasis in his lung. It was clean, fortunately. And it was offered aggressive radiation treatment. And when I asked why it's very aggressive, because we didn't have any checkup before the surgery. Nobody knew the size of his tumor. Nobody knew about the borderline. From the after the first surgery, borderline shows the cells. After second surgery, it was clean. But anyway, nobody knew basic stuff.
Yeah.
That's why it was offered very, very radiation therapy.
So he had clear margins. There was no evidence that it had metastasized anywhere, but their suggestion was, aggressive radiation and these types of approaches. You decided with your husband to say, hey, let's go in another direction. Let's look at other types of factors. I'm curious, before you started Rigvir therapy, which we'll talk about, did you, as a nutritional consultant, having looked at your own health issues, over the past many years and working with clients over the years, were there certain things that you started to change in your husband's diet to try to improve overall health and immune function?
Yes. Because I didn't have nutrition license at that time, but because I was 20 years myself on very alternative treatments and lifestyle. We have a healthy lifestyle. We have a diet already. But anyway, I changed diet immediately. No sugar at all, no fruits at all because of fructose. A lot of nutrition was added as a vitamin and minerals for his diets. And because I had my research during 5 months, I was very worried that something can happen during this 5 months. We was constantly checking his blood test. We was constantly checking his with the doctors and such, but not oncologists, because oncologists refused to do that because we refused to do radiology.
So it makes sense.
And also, because we went, the question why we went to this alternative treatment, because 1 year prior, we lost my sister-in-law for cancer. And she went through whole conventional treatment, chemo, radiation, everything she was done. And we lost her. And when my husband was diagnosed with myxosarcoma, he told me right away, I'm not going to do anything. I am going to die, but I am going to live whatever I can without any treatment, because he saw his sister.
So it makes sense in shifting his diet, no sugar, no fruit, okay, getting rid of that, because we know that cancer cells thrive on sugar.
We started keto.
Did you do anything else as far as maybe moving him in the direction of more of like a ketogenic diet?
Yes, we started keto. We started IV of vitamin C immediately. Also, Rife machine, what I had already, helped a lot, because Rife machine was actually opened and found on 1931 by Dr. Rife in California, and actually was started with 20 cancer patients for whom he started to do the treatments. And Rife machine has a special program for cancers, for different kinds of cancers, and we started to use that as well.
And I'm somewhat familiar with Rife, and I want to come back to that. So you mentioned, shifting of his diet, no sugar, no fruit, moving more keto, really cleaning things up from a nutritional standpoint. The no sugar helps to somewhat starve off, if you will, or at least decrease the potential of cancer cells from metabolizing so quickly. You also mentioned intravenous vitamin C, and that has been a therapy that's been around a long time. Again, not as a direct treatment for cancer per se, but support the immune system. When you're doing the intravenous vitamin C, I'm assuming it was fairly high dose, vitamin C? Okay. And so all of those things are being implemented. I want to come back to the Rife technology for a little bit later. I know you also do bioresonance testing, so I want to talk about that, but let's come back now to the Rigvir. So just to kind of give people a little background. So Rigvir is what they call an oncolytic immune modulator type of therapy. So it's something that I actually was not familiar with. However, when you read about the mechanism in how it works or what it's attempting to do, in essence, it makes sense, particularly in trying to bolster the immune system's ability to go after cancer cells. So they call it a virotherapy. So this is a non-infectious, let me ask you, this is a non-infectious virus or viral components that essentially tag themselves to cancer cells, but not to normal cells. Is that correct?
Yes, exactly correct. This is actually, I think, probably one of the stuff what can target cancer cells, what produced, the mother of cancer cells would produce the cancer cells, because chemo and radiation kind of killing a lot of cancer cells, but it doesn't kill the cell what produce those cancer cells. What Rigvir does, it destroys these cancer cells and help immune system to work towards.
Do you know if there is something, because the way it's described is that it's considered to be a non-genetically modified, non-pathogenic viral component. Is there something within a cancer cell that this non-pathogenic virus goes after and tags itself to that is different than what would be on our normal cells? Do you know about?
It targets only cancer cells. It targets only cancer cells and destroys that cancer cells. And also what is important, doesn't matter where your tumor sits, when you do Rigvir, Rigvir found itself those cancer cells throughout your body and destroys those cancer cells. For example, Before starting Rigvir, we did the circulation tumor test. Probably you know about that. The test would kind of check how many cancer cells you have in your body. Something like a liquid biopsy. So you take your blood cell, we do that through my clinic. And before we started Rigvir, he has a cancer cells. But in half year after doing Rigvir, he had 0 cancer cells in his body.
Interesting. So it really just eliminated any evidence of the existence of cancer cells. I know that they've used this therapy, or at least in the literature, for melanoma, for pancreatic cancer, for bladder, lung, liver, prostate. If it goes everywhere, then clearly it could be at least potentially beneficial for many different types of cancers. I don't know if you know of its effectiveness, let's say on brain cancer, if this thing easily crosses the blood-brain barrier. I'm assuming
Actually, Rigvir was used for melanoma, islet melanoma, pancreas cancer, bladder cancer, lung cancer, liver cancer, prostate, colorectal, cervical, kidney, neuroendocrine cancer, breast cancer, and different kinds of sarcomas.
Right. Okay. So briefly explain, and then I want to move, into some other topics. But what is the general procedure, at least from your experience, of this Rigvir immunotherapy? And also, and again, I'm assuming, but let me know if I'm incorrect, that this is not something that is readily available in the United States. It sounds like you actually had to travel internationally to obtain this intervention.
Actually, yes. When we started, yes, it was, we have to travel to Latvia, and we brought medication from Latvia. It's transportation is very tricky because Rigvir should be frozen, okay? And this is most important stuff, what you need to do when you do transportation of this medication. They have a special package to save Rigvir with a minus 72 degrees during the travel. What happened now during these years, of course? First, they open an office on Bagama, where patients from United States and Canada can go and take it. And it was done through COVID because travel restriction, it was very high, right? And now they have delivery, door-to-door delivery from Latvia to United States.
Okay.
People.
So,
and I already have few people from whom I serve, kind of, who had this delivery done.
So with your husband or other individuals that you've consulted with who've undergone this therapy, what, in general, what's sort of the general initial, time frame of intervention? How often is it used? And then sort of what's being recommended as far as long-term maintenance?
Of course, everything depends on the situation, right? If this is first stage, or this is surgery, this is one program. Or if nothing is done, it's another program. Or people have chemo and radiation and very late stage, it's different. Right. Most aggressive treatment, this is first 3 days, during first 3 months. Because every time 3 months, and doctors in Latvia checking blood tests, PET scans, MRI, and suggesting decrease or increase the time between injections. Most aggressive program, it's first 3 days, every day 1 injection, and afterward, during 3 months, 1 injection per week. Next 6 months, depends on the situation. We had during half year, 1 injection per week. After that, they started to decrease injection. First of all, 1 per 2 weeks, per 1 month, per 2 months. Now we are doing 1 per 3 months. Okay? And most the people whom I know who are long enough on Rigvir, this is kind of safe of mind. I don't know how to say. Because I see that people are okay. Their lifestyle okay. There no side effects at all. I can tell you, for example, when we started, we went to Latvia. We started from Rigvir, 3 days Rigvir, and through our stay in Latvia, in Riga, very beautiful city, we walk around from 9 o'clock in the morning till 9 o'clock in the evening, and my husband was absolutely okay. It means no side effect, no side effect. Some people, the program, like doctors tell us, should go minimum 3 years if you have a middle condition, I would say. Some people stay 5 years, some people stay longer, depends. But most of people whom I know and who started this treatment early and in time, this is peace of mind. That's it, right. I would say.
So, I mean, like anything, it's always individualized, and what we're talking about here is we're not talking about specific things like people should or have to do this as a treatment. This is certainly a consideration, and like anything, something that they need to discuss personally with their personal physician. But I think the key is that this is a very intriguing intervention, to say the least, with regards to its impact to at least augment or induce the immune system to go after cancer cells, which there really isn't much out there, for these types of things. And I think the thing that's also intriguing about this, in what the literature that you sent me, was that it's not only used in early stage, but late stage, and even metastasis. So, for some of these cancers, there is very little available for the severity of the condition. I'm curious, Elena, in your experience outside your husband, and some of the other people that you've done nutritional consulting with, perhaps discussed other patients, individuals that are undergoing this therapy, is there an example that you know of, let's say, somebody who is extremely advanced in their cancer, metastasis, that you've seen improve, with this intervention?
Yes, I do. I'm not talking about all people, because everything individual and everything unique. But yes, I do. I know some people who was nearly to death, and doctors told them you have 2-3 months ahead, but they are still alive. I do have one woman with ovarian cancer. She has a lot of metastasis already. I do have a woman with melanoma. She had more than 200 metastasis in her liver. I do have a person with the kidney. Actually, you can find this study in PubMed, and I think I sent you a link as well about this renal carcinoma. He is more than 10 years already alive.
And how at this point, where are things with your husband, and where are things progressing? I mean, you mentioned he did a test, everything looked clear. How often is he doing this therapy as a maintenance therapy even?
One time in 3 months right now.
Okay. Excellent.
And also, which is very important, what I would like to mention, that these treatments can be combined with chemo and radiation as well. They have a special program. You cannot do Rigvir at that day or between, I think, 5 days with chemo and radiation. I don't remember exactly, but this treatment can be combined together as well, and this treatment can prolong situation.
Great. Well, let's shift gears and talk a little bit about Rife, and then I want to finish up on bioresonance testing. So, Rife, this is something I'm somewhat familiar with. I know that it was developed by a Dr. Rife, who was an American inventor. We're looking at multiple frequencies, for example.
Yes.
And in my recollection of Rife, a lot of it was used, again, to kind of help decrease opportunistic microorganisms, for example. But what has been a little bit about Rife and how you use Rife technology in your overall, assessments or, recommend suggestions for people with regards to their health?
Rife has a lot of programs. When you're going to buy a Rife, about 900 programs come together, already programmed programs. Also, 200 frequencies, what you can play and program yourself. Okay, it means this is very wide option how to program those frequencies, and it's definitely decreased the pain. And I already told you as an example, I had a gum surgery. I didn't take any painkillers. I didn't have any antibiotics. I came home. I opened my Rife machine. And during 1 hour, I didn't have any pain. And also, I didn't have any complications after. I can do detox. I did detox for my husband after all his surgeries with anesthesia. Of course, it's killing microorganisms. It's cleaning up your microbiome with the aggressive microorganisms.
And so
a lot of other stuff.
With Rife, like some of these other types of things, it works off of frequencies. So, the way I kind of explain it to somebody would be like, when you turn on your car radio, it's vibrating or it's outputting or it's picking up on certain, wave formations and frequencies that exist from an electromagnetic standpoint. And so we can think of our body as being electricity and being linked to the natural rhythms of the earth. And we have the sun and everything else. We've got these other electromagnetic frequencies that are part of the natural world. Well, our body is part of that too. And so we vibrate, or our cells vibrate with a certain frequency, which means the microorganisms will vibrate with a certain frequency. And my understanding of Rife is that at least at a certain range, it can help to either, what does it do? Does it match a microorganism's frequency and that somehow eliminates the microorganism? Or does it override a microorganism's natural frequency to where that microorganism can no longer survive? What's your understanding about what the Rife frequencies are actually?
My understanding depends on the parasites, for example, because parasites are also different, right?
Right.
For example, myself, I had a very strange type of dermatitis, allergy, and nobody can help me. I had a rash in the skin. My skin was breaking and it was coming out some kind of liquid. It was a terrible situation. And I found a naturopathic doctor who started to do Rife machine treatment for me. And I went for this treatment during probably half year and realized that half hour per week is absolutely not enough. That's why I decided to buy. And as soon as I bought this machine and started to intervene with treatment for myself, during 1 month, everything is gone. But I had a very aggressive treatment. I put a lot of programs for every organism I can, candida, some other stuff, okay? Every programs, and I said, you can set 10 different programs at the same time. And I run sometimes, when I used to work from home, I run sometimes, machine was staying close to me during whole day. And actually it helped.
And so this is essentially they have Rife machines that people can purchase themselves, have at home.
Yes, and actually, right. Absolutely, 100%. And actually, when my husband was diagnosed by myxosarcoma, Rife machine itself has different kind of programs for any cancer treatment. Adenocarcinoma, some other carcinoma, they have a different kind of treatments. And we started to do this for my husband as well, almost every other day.
So what is then the difference between bioresonance and Rife frequency? Because I know with bioresonance therapy, it falls in this category of this biophysical, bioenergetic, vibrational medicine. Because we talked about the frequencies with Rife, right? But our cells, including cancer cells or other disease cells, and I'm assuming even microorganisms, will sort of oscillate within these, their own sort of electromagnetic patterns. So what is maybe, I don't know if there's really a difference or kind of
it is a different
symbiotic relationship perhaps between Rife and bioresonance. So tell us a little bit about bioresonance.
First of all, bioresonance. This is a scanning machine, okay? You can scan human body with all organs inside. It means each organ you can scan and going analysis through this scan. You can see different kind of information coming. And I sent you the scan report example. You can see, for example, system disorders, what person has. You can see the vitamins and minerals deficiency. You can see microorganism and pathogenic flora. Depends on the number of titer. You have to understand which one is more aggressive or less aggressive inside of your body. It means if I see, for example, Toxocara or Clostridia, very small titer, for example, close to 0.0 something, it means it's very, very, very aggressive right now. And I have to think that I have to treat those at the beginning of treatment. I can see allergics and toxins. I can see contaminants. I can see whatever I can see. A lot pH level of the organs, which is also very important.
So I have a question. I'm curious, either with Rife, or maybe it's something that's more recognizable with bioresonance assessments. What do you see happening in people who are constantly carrying their cell phones close to their body? Whether it's in their back pocket or a woman carries it in her purse or somebody has it, somewhere on their body. Do you see the EMFs essentially that comes off of cell phones or computers or Wi-Fi affecting these bioresonance oscillations?
I understand your question completely. And I can tell, and I can ask you, do you know the people who doesn't use computer or cell phones right now, or whom you can tell that stop using that.
Yeah.
No, right?
No, exactly.
Absolutely no.
Yeah.
Yeah, I cannot stop myself. I hope, I imagine you cannot stop too, right? What the resonance scanning does, it scans based on the DNA level, based on cells level. It means, for example, for cancer, cancer can be diagnosed with tumor is already big enough, right? Or people have a pain, or people have some kind of complications what bother them, right? What the resonance can do, the resonance can find cancer in basic cells or any other disease or on any basic steps. It means when blood test doesn't show you that you have this, the resonance already showed you that
Right.
you have to kind of think about.
That's a great point you just made in that do we know anybody that doesn't have a cell phone, doesn't use it? So really what's happened is that our world has now been permeated by these, artificial aberrant frequencies. And so unfortunately, our biochemistry, our body's physiology has to adapt to that. So, I mean, in many regards, you could say, well, maybe we're all living in some sort of abnormally or some altered state than what we lived in, even 20 years ago, 30 years ago.
Yes.
We're not even exactly. That long, So as we come to an end here, Elena, any last thoughts on just general recommendations for people from a nutritional standpoint, from a lifestyle standpoint? And then I think also, let's start with that, just from a general standpoint. Then I want to ask you, what are some recommendations that you would make for anybody that they themselves or have a loved one who's been diagnosed with cancer? Some things to just consider. Of course, we're not advocating treatments, and everybody needs to work with their individual practitioner based on their circumstance. But as a general health, standpoint, what are some things that you recommend that people look into?
From the general standpoint, first of all, I recommend look for your health before something has happened. See your doctors, see your nutrition specialist, see your integrative specialist, because integrative functional specialist can see problems coming before it's coming, right? This is
right.
Just my recommendation.
Fundamental.
Second,
yep.
Very, very important, I would say, very important. And also integrations, doctor, nutritionologists, they kind of look a little bit differently from conventional standpoint of medicine, because it's, I always tell that we have a great medicine, but each of our doctors has a very, very small, very, very small specialty. And they're not looking for everything else at the same time. Integrative doctor or integrative specialist that's looking for whole body perspective. This is first my recommendation. Second, my recommendation, I would say diet. Healthy lifestyle diet. Try to avoid any processed food. Try to cook with healthy oil, which is very, very important to avoid inflammation. Try to avoid a lot of fruits, because this is also fructose, which is sugar, and it helps feed all your microorganisms. Also, what I forgot to mention, actually, outside of cancer, we have a Lyme disease, right? And Lyme disease also can be treated very, very, very good with the Rife machine and with all my recommendation, what I am telling right now. Diet, this is very, very important. I would say nutrition deficiency. And nutrition deficiency, you can check by your suggestion, first of all, from organic acid test, which is very important. People absolutely doesn't know about. This is excellent tool to find out problem, deficiency, and such. I would say, if possible, bioresonance scanning, because bioresonance scanning does a lot of information about. When cancer is diagnosed, I would say circulation tumor test or liquid biopsy test, cancer markers before even any biopsy, because all these liquid biopsy, circulation tumor test, and other cancer cells can show you the kind of where are you right now with your cancer. For people who have a breast cancer, I would like to mention, I don't know if a lot of people knows about, but in South Carolina, there's a doctor who are doing tumor freezing, and actually it's covered by insurance right now, which is also very, very important. And she has a very, very success result after that. I have already 2 of my friends who did that, and they started Rigvir after. And by doing liquid biopsy before, they had a cancer cell, and right now with Rigvir they don't have a cancer cell. It means no surgeries. Again, I'm not telling to do only this, but I mean this is my suggestion to think about.
Yeah, these
because
are all...
everyone can decide their own. Nobody can push it, right?
These all great in general recommendations. I mean, I completely agree from a nutritional standpoint, decreasing sugar consumption, eating healthy fats. A lot of times when it comes to nutrition, it's just as important, certainly important what you put in your mouth, but probably even more important what you don't put in your mouth, what you avoid, and so all of that. And I think, when it comes to these things are preventative, and obviously if you're diagnosed with cancer, these things can still be supportive because we're trying to optimize potential. And I think the Rigvir is certainly a very intriguing intervention to consider for anybody, in the consultation with their health professionals. So let's wrap this up, Elena. I want to ask, do you have any resource recommendations? You sent me a documentation in your podcast page. I'll make sure to give some links. How do people get in touch with you if they want to find out more about what you do, or perhaps get some guidance on the Rigvir?
First of all, I am building my Instagram page right now where I could put all this information. This is first of all, and I sent you a link about this Instagram page. It's under construction right now, but I think it will be soon. Second of all, I sent you my phone number and I sent you my email. People can contact me through that as well. And as soon as somebody contacts me, I can immediately ask about the blood test, MRI result, PET scan, whatever they have. Doesn't matter what they don't have all package already, right? But I can put this information to Latvia database clinic, and clinic will contact them. For example, all my clients in 1 week have contacted by clinic. They contacted with the doctor. They have a doctor's consultation, what they need, because doctors already check all their tests. And they have a program what clinic suggests. After that, they can decide they go or not. But at least you're not going to pay for that. This is free.
Right.
And this is second options to find out who and how can help as well.
Well, it's excellent. Well, Elena, thank you so much for joining me today on the program, and keep up the great work.
Thank you so much for inviting me.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.